And for more on this story, we're joined by Marc Paguelin. He is an expert on infectious diseases at Imperial College London. Thanks so much for being with us. At this point, what do we know about the effectiveness of a third shot?
To be honest, I don't have a lot to tell about this. I think the challenge at the moment is not really third doses, but first and second doses for a lot of countries. And I think the coverage of first and second doses is what can fight efficiently against Delta. And I think the boosters, which might be something in the future, is not really the important question of the moment, I think, in terms of public health.
So, the WHO is saying that we should all just sort of take a step back before all of us run out and get a third shot. At this point, you say we don't know much about the effectiveness. So is that something you would recommend?
As I said, I don't really think it's at least for my perspective, which is looking at the population effect of high coverage and how we can balance rollout of vaccination and lifting of non-pharmaceutical interventions to try to open countries. I think the real challenge is to get as many people with the first and second dose. I think the third dose might be something if there's a proof that there's waning immunities from a second dose of vaccine and that there's a need for boosting. So this would be something in the weaponry of response. But I think at the moment it's not what's in the current questioning, I think, for the public health response.
Okay, well, then let's talk about this in some more general terms. I imagine that at some point the immunity from a vaccine wears off. So do you think that getting additional shots, maybe every year, for example, will be something we will have to do?
Yeah, no, that's in terms of a general principle. I think we see with flu, is some pathogens, some viruses are evolving with the appearance of new variants. So there's two things. One, your immunity is waning, and also your immunity becomes sort of irrelevant because the variant which is circulating is different from the one you have seen in the past. So yeah, I think it's something probably which will happen in the future, that the virus will keep evolving and we will have to just get boosters or new vaccination with slightly evolving variants.
Now, in the UK, where you are, they've been dealing with the Delta variant for some time. What do we know about the effectiveness of vaccines in that situation where you are in the UK?
So I think the measurement that Public Health England is doing a monitoring of the efficiency of the vaccine, and I think the vaccine efficiency is quite high against the variant. Looks like there might be a bit of loss, but it's quite still good. So I think the main challenge at the moment is really for countries which are going to face the Delta variant to have the coverage which is high as possible.
Okay, we want to thank you, Marc Paguelin, expert on infectious diseases at Imperial College London. Thanks so much for your time.
Thank you.